All right, in this video I want to talk about bone on bone as it relates to hip pain. So I hear a lot of people on a daily basis that come in here and they just got an x-ray or an MRI. They met with the surgeon and they were told they have bone on bone and they need a hip replacement. And I want to just kind of dispel the myth of bone on bone. So first of all, we know that bone on bone is another word for arthritis, degenerative joint disease, and the way that that is determined is through measuring the space between the two bones in your hip, the pelvis and the femur, measuring the space. The smaller the space, then therefore the higher severity of arthritis or bone on bone. The problem with that is that there's a couple problems. Let's talk first about asymptomatic research. So research looking at hundreds of thousands of people and giving them an x-ray or an MRI in their body and they have no pain at all. So what did they find? Well, let's look at the hips specifically. So in this study we had 2,114 people without pain, gave them an x-ray and an MRI, and they found that the majority of these people had something structurally wrong with their hip. A cam deformity was 37%. A labral injury, which is the cartilage ring on the outside of your hip socket, 68% of those people. A pincer deformity. And so what we're finding is that we are finding structural changes in the joints when we give images. So we can't let the image be the only thing that helps us or tells us what's actually causing the pain. And so now let's talk a little bit more about arthritis or bone on bone. And so we know that arthritis is in the body. It's natural. It's occurring in everybody as we age. We know that asymptomatic imaging studies show that some people have arthritis with pain and some people have arthritis with no pain. So therefore arthritis does not equal pain. It is one diagnostic tool to help us. It's one piece of the puzzle. Now, the reason I don't like bone on bone when somebody's talking about your hip is because if you think of the physics of it, it's really not even possible. So if our bones, bones come together to create a joint. The joint is a space, and that space is designed so that movement can occur, right? So first of all, if there was no space between the bones, there would be no motion because there's no way for motion to occur. Now, we also know that my doctoral thesis was studying the forces that travel through the leg when we walk or run. So I know from research and studies and the article that I published that every time you're walking and your heel hits the ground, there's 2 to 3 times your body weight in force that travels through your hip joint. So that means if I'm 200 pounds, that's 600 pounds of force that would travel through my hip joint. And we know that it only takes 800 pounds to break a femur in half, which is the largest bone in the body. So if you had 2 bones, your femur and your pelvis, that were actually touching when you're walking with 600 pounds of force slamming the bones together, we would have at minimum bone bruising, which occurs when bones get hit really hard, or better yet, bone fractures or fragments that are happening with simple activities like walking. We also know that when we run, it's 3 to 5 times our body weight. So now we're talking about 1,000 pounds of force that would be slamming our bones together. That's not happening. We also know there'd be no hip motion occurring. So if we think about that for a second, why are we told bone on bone? Well, I think it's a fear-mongering metaphor. But the reality is it's just not happening. Bones are suspended. They have capsules around them, ligamentous capsules that enclose the joint space, and then there's fluid inside. And then we have tendons, ligaments, and muscles that keep those bones suspended in tension. So we know that the new anatomy model is called biotensegrity, and it states, this is actually a model of anatomy that's been created by an orthopedic surgeon, which is fascinating. It states that the fascial network and muscles become weak. If they become weak, tight, or aligned incorrectly, it will not be able to hold the bones apart anymore. But in somebody who has bones and muscles and tendons, and our body is designed to hold those pieces apart. So if we're having bones that are getting in contact, we need to focus on the soft tissues around it, the fascial network. So again, we don't have bone on bone. It's just not happening, and we know that bones and connective tissue, that is there to suspend our body in tension so that we can move. So if you have no hip motion at all, and an X-ray where there's showing joint space is really narrow, it's possible that you have bone on bone, but the majority of people that I meet do not have that. And so we need to think beyond the imaging. The image of arthritis or a labral tear does not tell us that that's equaling our pain, right? Because we have two things. We have asymptomatic imaging studies that prove that's not the case. Some people have structural change with no pain at all. Some people have pain with no structural damage. And so we've got to think beyond that, and bone on bone is just a terrible metaphor, and I hope the rest of this playlist helps you.